Thank you for joining me today. This is the Bold Lines podcast, and I am your host, Travis Thompson. Today, we're going to be talking about sorting through treatment and medication. Today's topic is interesting. It can be full of emotion and strain and a ton of anxiety. I'll start by saying I'm not a psychiatrist. I can't prescribe medication, and I'm not going to pretend that I know every in and out of any kind of medication someone would use for a mental health disorder. These things are coming through my experience as a therapist, as well as the research that I've seen, and even how culture has shifted over time when it comes to medication and treatment. If you want to learn more information or hear more about my point of view on this, if you go to my book, To Those Left Behind, in the chapter Telling the Kitten Goodnight, you'll find more about this topic there. So let's first sort out, how do we see treatment and medication in today's world? We're living at what I would call near the tail end of behavioral models of treatment and therapy. They've certainly found their use in helping people shift their behaviors and therefore the outcome of their lives, but it seems as if the psychology field and culture in general have become discontent with the idea that simply changing the things that you do changes your character. And in that, I would agree. Certainly, there are behavioral skills that are important and have helped people a great deal. However, simply treating someone's behavior doesn't heal their soul. I would argue even in times where behavioral therapies have exceeded expectations, the healing hasn't been in the therapy itself. It's been in the sense of hope that someone has gained, along with skills that have helped get them there. Away from this behavioral model of treatment, of therapy, has come this greater idea of identity and who we are. So this is what we're talking about today. How do we move from this behavioral point into an individual sense of self, how they form their identity, and what that has to do with treatment and medication? So outside of this behavioral model comes this idea of who we are besides just the things that we do, how we see the world, the beliefs that we have, not just the thoughts that we can interrupt. So let's go over diagnoses and what they mean, as well as the treatments that are helpful. A great place to start in diagnostics is to see anxiety and depression for what it is. Most of us have experienced anxiety and depression, and for those that haven't, you're either some wild exception or you're not paying attention. Anxiety and depression can be very clinical. We have DSM diagnostic criteria for anxiety and depression, but anxiety and depression are also part of the human experience. We should be anxious if something bad is happening. It keeps us alive. And depression is something that we experience to help make sense of how the world works and loss. So when it comes to treatment, should we treat the things that are human in us? Or should we experience them? Anxiety and depression are different from other things that I've experienced working with in treatment, particularly something like schizophrenia. Now, schizophrenia is not a part of the human experience. Seeing, hearing, feeling things that are not there is not something that everybody experiences unless they're unconscious and dreaming. For that, you can't really empathize and say, well, welcome to being human. You see people that aren't there. It's a little more complicated than that. So, should we treat schizophrenia and anxiety differently? If you're on the edge of your seat wondering what the answer would be, maybe you haven't listened to past episodes. But yes, obviously we treat them differently. Of course. One is about how our lives work and what gives us meaning and identity in the world. And then another one is the result of screwy neurological wiring. So, diagnoses determine treatment in a lot of cases. I will tell you that some diagnoses require medication and some do not. Something like schizophrenia is not going to get better with behavioral therapy. There's no amount of individual, family, couples, or spiritualized therapy that is going to heal schizophrenia. Medication is about the only thing that we know of. It's not a behavioral issue. Someone can't just happen upon schizophrenia, and you can't give it to someone either. For that, that's a pretty straightforward thing in my book when it comes to the use of medication. Now, can you make schizophrenia worse from your behaviors? Well, yes, but the idea of schizophrenia itself is not something that can be transmitted from person to person. It's not something you can experience all of a sudden. So that one sounds like a medication thing to me. But to the more common ones, like anxiety and depression, do those require medication and treatment? From a clinical perspective, medication can be used for anxiety and depression. Once a certain threshold has been met, then medication is recommended. But here's the thing. There's a difference between what is considered clinical and what doctors and nurses consider worthy of empathy. Now, this isn't a knock on anyone in the medical system. Don't get me wrong. There are places for everybody who is wanting to help. But I worry that sometimes things like anxiety and depression are treated as clinical when in reality they're not. So, do you or does someone you know require medication? It depends on what they have and what the severity is. Technically, someone could be diagnosed with something like obsessive compulsive disorder and not need medication at all. Does that mean that they don't have the diagnosis? Well, no, I just told you they did. But if they are able to work around the way that their brain is wired, if they're able to cope and make sense of things and live a healthy and productive life, why would you need medication? But if this OCD becomes so severe that someone locks themselves inside their home and becomes so fearful that no one can enter, maybe medication could be helpful. If things are so severe that someone is unable to live their lives because of a legitimate mental health diagnosis, of course, medication is helpful. But something's important here when it comes to medication and treatment. You see, diagnostic criteria and correctly diagnosing someone is not as simple as reading from a list of symptoms and correctly identifying what someone might have. I'll give you a great example of this, and one that a lot of researchers have begrudgingly and sadly acknowledged over time. If you're old enough to remember the ADD, ADHD craze, when every young boy had ADD and ADHD, and all of them needed Ritalin, you'll know that it seemed as if the stuff popped up out of nowhere. I would argue that some of those boys absolutely had ADD and ADHD. I would also argue that the school system isn't the most conducive to young boys' bodies and brains. I would also argue that someone could get a diagnosis of ADHD and actually have something like post-traumatic stress disorder or PTSD. Now you might be asking, wait a minute, how do those two things go together? So follow me here and I'll see if we can make the connection. When someone experiences repeated trauma or a wildly traumatic single experience, their bodies and their brains have to adapt. And one of the ways that's really common in children, particularly boys, when it comes to trauma is continual movement. They can't sit still, they can't be alone with their thoughts, and they constantly have to be moving and processing. To the unknowing psychologist, to the unwitting participant in seeing that kid and treating him, his symptoms could look a lot like ADHD, when in reality he's traumatized. I'm incredibly thankful that thoughts on diagnoses around ADHD have shifted, because a lot of times the rambunctious child, the one who won't sit still, is the traumatized one. And if we gave someone with PTSD medication, they might get better, but not really. Their behaviors and symptoms might change, but doesn't mean anything was actually helped. So diagnosis is incredibly important in terms of treatment and medication, especially around things that could come from trauma. Another little side note, something if you're interested in higher levels of diagnosis and more what's considered complex cases. In personality disorders, no medication actually works for personality disorders. Things like borderline personality disorder, histrionic personality disorder, all of the things that people know about. People with borderline personality disorder can get diagnosed as bipolar because their moods shift up and down. Now, the DSM is very clear that borderline personality disorder and bipolar disorder shouldn't intersect hardly at all, if ever at all. That doesn't mean that the psychologist has all of the information that they need or that they've done all of their due diligence. So something like that. A person might receive a diagnosis that's inaccurate, be given therapy and medication that is ineffective, and come to the conclusion that they must be some sort of screwed up, that no one and nothing can help them. But let's imagine that we've got a correct diagnosis, something that is so overwhelming to someone that their adaptations and their coping skills don't get them where they need to be to live a healthy and productive life. Let's also assume that this person has gone through every route possible to try to make things work. They've changed their diet. They've worked on their sleeping patterns. They've balanced their relationships, and still something seems off. Well, that's what therapy can be for in a lot of ways. This is where we start to explore why things are happening. Outside of just a behavioral model, this is how a lot of people come to understand who they are and how they've come to be. In a therapy setting, let's assume that I have a client in front of me who's done all of this work and is still struggling. Let's say we know they don't have PTSD. Let's say we know that their anxiety and depression is measured, but they still can't focus. And I know nothing's ever 100%, but let's say we had all of our bases covered. I think medication's a great option then. Now, here's the thing. Medication is not a Band-Aid, or at least it shouldn't be. Medication should only be used to give someone a fighting chance at life. If someone is given medication greater than just what is needed to give them a fighting chance, it can start to become a problem. It can start to be the solution for problems instead of just something that allows a person to engage in their life fully. Medication should always be open for adjustment. Something's too much, something's not enough, and you can make peace with yourself and your therapist and your loved ones that a change needs to happen, then go for it. As a therapist, I'm obviously going to give recommendations on whether medication would be helpful or not. Again, I'm not a psychiatrist, but I've seen this enough to where I can tell if something isn't working. Now, granted, it could be me, but what if it's not? And I have a client in front of me and both of us have done everything that we can do and still a client struggling. I'd be all for medication. Not that I'm the gatekeeper for meds if I have a client, but I want the people that I work with to have a sense of autonomy, to have a say in how their lives go and what's important to them. And so I'll give pushback to anybody who recommends medication, not because I'm against it, but especially nowadays with how easy it is to get any kind of medication, I want clients to really think through it. But if they've come to the conclusion that medication's needed, they've done everything they could, and they're still losing out, why not? In a lot of cases, when clients have gotten to that level, it seems to be the push that they can do greater work where I see great benefit. Once a client gets to the point where they can lean over the edge and make sense of things, my goodness, people take off. I myself take medication. And it's not because I just feel like I don't want to work on stuff. It's because the wiring in my brain is just off. I've accepted that probably for the rest of my life, I'll need medication. I had to go through this myself. How much medication is a crutch and helps me avoid, and how much of it is an aid to actually engage in my life and in my relationships? This is what I would pose to anybody listening. If you've been open and you've tried to be objective, is medication helpful for you? Of course, affordability is always an issue in this, right? Some medications will cost you $10 a refill, and for some crazy reason in the US, sometimes medications cost $800 to refill, and some cost $5. So yeah, obviously that's going to play a factor, but if you've been willing and you have the flexibility, know that it'll take time, but it can be very worth it. I'll give a little bit of warning to anybody listening who's considered medication for really concerning things in their lives. One, it's not going to be a miracle cure. It's going to take time, and your body has to adjust to it. So at no point are you going to take a medication and the next day everything's great. If it works that way, well, let me know, because I could use some. That's half a joke. But medication is a long-term process that you always have to keep track of, because sometimes people's bodies adjust and you need a different dosage or something different entirely. I hope by this point in the episode, you've gotten the idea that I try to be as objective as I possibly can. Of course, everybody comes to medication with different preconceived notions, different things that they've heard from different generations and backgrounds. I try to stay as in the middle as possible and see medication as one thing only, a tool. Medication does not fix a relationship. Medication does not fix a family dynamic. Medication does not resolve trauma. And even in something such as the case with schizophrenia, maybe you take the medication and it goes away. The voices are gone. The strained family relationships are still there. And what about the side effects of medications like that? The really heavy hitters for diagnoses like schizophrenia often cause things like weight gain and lethargy. So you're not seeing people, but you're gaining weight and you feel tired all the time. Medications are not magic, but they can be incredibly useful. When it comes to treatment, like I said before, there's a vast difference between something like anxiety and depression and schizophrenia. So I've talked about where it's necessary. Let's talk about where it's variable, where there's wiggle room on how we handle it. In something like anxiety and depression, medication can be a helpful tool to help someone take the next step. It's also something that can be tapered down or completely put to the side over time. It seemed that a lot of the clients that I've had have come to the belief that if you start taking medication, you're going to take it forever. And that's not the case. Barring some great neurological issue that certainly people struggle with, you can stop the medication whenever you want. If it's only a tool, let's give it the emotional investment of a tool. Once a tool is no longer needed, why do you have it? So for anyone listening who's been hesitant about medication, just use it. If you really feel like it's something you're afraid of Try it as a tool, not as some emotional or moral standing. If you're against it, okay, that's fine. Try all of the skills that you can think of. Go to people who have understood anxiety and depression well in your own life. Maybe you need medication for a short period of time. A great example of a short period of time is, let's say you experience a death in the family or the loss of a loved one. Some people go into a depression that's healthy. You need to feel bad when you've lost somebody. It shows that you cared and you loved them, and loss is a part of the human experience. But let's say that it goes a little too far and you start slipping away at work and you have some disconnection from family, and as much as you can muster, it doesn't seem to be enough. Maybe something really low dose could be helpful. Again, you need to go to a licensed medical professional for it, but I've seen that work. I've had clients that have been on medication for a few months, gotten over the hump, done all the work they need to, and thrown it away. The big question when it comes to treatment and medication is the pill in front of you, or at least the one that's offered. Is it going to be used as a crutch or an aid? I said earlier, meds don't fix relationship. So what happens when the symptoms go away? Do you fall back on the diagnosis as a way to gain excuse, or are you willing to do the work to make things right? If you underdo medication, you can feel a sense of loss or despair that might not be accurate or necessary. But if you overdo it, you can detach from the reality of the human experience, because we need to feel depressed. It's how we feel love and connection. We need to feel anxious. It's how we know when danger's around. So if we do too much, if we take too much medication without regard for experiencing life, we become what I have heard described many times as a zombie. And you walk through life without anxiety, without depression, but instead of euphoria, you feel nothing. That's when you know the meds are too much. And I really hope that you don't get to that point, or if you're headed that way, you know to stop. Let me pull this into what I consider to be the biggest point of all of this. When it comes to medication, at least how I've seen it in my practice, people should only take the minimum amount of medication that's necessary for them to do the work. Anything more than that undercuts your ability to grow. Anything less than that can cause a sense of despair or hopelessness. When you can marry therapy or personal work with the minimum amount of medication necessary, you might be able to just move forward in life. Maybe it's a short-term thing. Maybe it's not. For someone like me, it's not. And I've had to come to terms with that. For you or someone you care about, it might just be a short-term thing. And for that, be very grateful. But maybe you've heard this episode and wondered, am I doing everything I could to help improve my life before I try medication? If you've been wondering that, if the thought has ever crossed your mind, as you've been sitting here listening, try it. Try doing everything that you need to do without medication. See if it works. I hope you don't need it. Please, for anybody listening, this episode is not about trying to get people to use medication. I would be thrilled if I didn't have to take any, because I've got one of those old people pill containers. I know that might be offensive, but it's my podcast. I'll say whatever I want. Where you have the morning and night ones, you press little tabs. Ooh, it would be great if I didn't have to take those anymore. So if you're one of the listeners out there that doesn't, good for you. For those that have realized that they've done everything they could and it's still not enough, I would ask you to be humble and start doing research. Don't just go to the internet and find people's opinions. Ask people you care about. If you have a therapist, ask them what they think. Try to get honest feedback and see what happens. I hope today that you've gained some insight into what medication is and what can be done. I hope you've heard that I'm not someone who just wants to throw medication out like candy, and I'm not someone who's afraid of it either. It should just be a tool. And it's been great when aligned with the correct therapy. A small amount of medication and very effective therapy is one of the most effective things that we see in the mental health field. So if that's you, I would encourage you to ask people around you. See what you think. Take the time to understand it yourself. Know the side effects of what your doctor is recommending. Know what to look out for, what the dangers are, what the good signs are as well. And see if this is something that would encourage you to do more work on your own, or maybe take the next step to talk to someone who's qualified to give you those meds. Thank you for listening today. I hope that you gained something that could be helpful to you and to those around you. If you feel the need, you can leave something in the tip jar so I can pay the producer. If not, I hope that you subscribe to the podcast and share it with those around you so that they can see healing in their lives as well.